It is my pleasure now to welcome our final speaker, Dr. Darby Miller, who is representing the American Academy of Ophthalmology and who is the president of Florida Society of Ophthalmology. He will discuss the topic of how can ophthalmologists influence the political arena. Thank you.
Well, hello. My name is Darby Miller. I'm an assistant professor of ophthalmology at the Mayo Clinic in Florida. I practice cornea, cataract, anterior segment, and this morning I'm going to be giving a webinar on what's called "How Can We Ophthalmologists Influence the Political Arena?" And I have no financial disclosures. All the work that I do for the American Academy of Ophthalmology and the Florida Society of Ophthalmology is voluntary. I'm chair of the Young Ophthalmologists Advocacy Subcommittee for the Academy, and also on the Surgical Scope Fund, which I'll go through here in a little bit. So this is a quote that I think kind of sums up what I'm going to be talking about this morning. And I'll just read it. Just because you do not take an interest in politics does not mean politics won't take an interest in you. And this is, claimed to be from Pericles around 430 BC. And this is very true. If you don't be an advocate for yourself, for your patients, for your profession, and you sit on the sidelines and you're not at the table, things will be happening to you, to your patients, to your profession, and you will not have any input. So you do need to take an interest in politics. So influencing the political arena. There's another quote by a United States Senator here in the US that states, if you're not at the table, you're on the menu. Again, same thing. If you're on the sidelines, if you're not involved, things will be happening that will affect your patients and your practice and the profession of ophthalmology. So you need to get at the table and have a say. And so how do you do that? At least in the States, joining local, state, and national ophthalmology societies is a big way to do that, because you can speak with a unified voice if you have a large number of physicians, ophthalmologists beside you. Make sure you educate yourself on the issues that are facing ophthalmology and medicine, and certainly participating in advocacy events. So one example, at least in the States, is the American Academy of Ophthalmology's MidYear Forum and Congressional Advocacy Day, which we do every year. And I'll go a little bit more into that shortly. But fundraisers, at least in the States, are very important. So you can support members of Congress, financially, host a fundraiser, be at a fundraiser, especially for members of Congress that are advocates of ophthalmology or advocates of medicine. A good example of this is Dr. Marionette Miller Meeks, who is here in this photo. And she is not only an ophthalmologist, but also a US Congresswoman. So she really has a voice in Congress that is speaking on our behalf, on behalf of ophthalmology and behalf of medicine. So MidYear Forum, what is this? So I don't know if there's something analogous in Europe, but this is an annual event that the American Academy of Ophthalmology does each year in Washington, DC. It's coming up here in April, but where basically the leaders within ophthalmology come together and they advocate on behalf of patients in the profession. And we go to the Hill. We actually speak with the congressmen and senators. We speak with their staff. We also have 170 what we call advocacy ambassadors that come each year. And advocacy ambassadors are members in training. They're residents at programs throughout the United States. They travel all the way from Oregon, Washington, California, all the way to DC to represent their states and represent ophthalmology on the Hill. And so topics that we usually discuss, at least this year, we're going to be talking about reimbursement. So Medicare reimbursement, which is the major government payer insure patients 65 and older in the States. We also have to talk about scope of practice, which, in the States we have scope of practice battles with optometry, unfortunately. And then another couple things called prior authorizations and step therapy and NIH and NEI funding. So advocacy, just, this is giving someone a voice that does not have one. It's how we can better serve and protect our patients and the profession of ophthalmology. You have to work together. That's the only way to get things done. No one is big enough to be independent of others. This is the founder of Mayo Clinic famously penned this, a couple hundred years ago. So this is really a team sport. You have to do things together. And there's a couple of different ways you can do that. So obviously you can advocate on a patient or an individual level. So I'm fortunate enough to have a few prominent politicians as my patients. And the best thing that I can do is provide excellent care for them, in the clinic, in the operating room, and also be a resource to them. So if they have a question, let's say in a month or two about ophthalmology, about reimbursement, about scope of practice, I can be a resource for them. Locally, you can get involved with your local ophthalmology society, your local medical society, your state medical society, your state ophthalmology society, and then certainly your federal or national or societies as well. So again, collaborations, teamwork. At least in the States, we can work together with lobbyists. We can work together with medical societies like the American Medical Association, surgical societies like the American College of Surgeons. Political action committees are very important. This is how we contribute financially. This allows us to speak to a congressman or a congresswoman or senator with a unified voice. So we can say all of ophthalmology believes that we should be reimbursed more fairly for our services, or we should only be the only profession allowed to perform surgery on patients' eyes, and that optometrists are not qualified for that. This is what it looks like, at least in the States. There's many different funds that we can contribute to. Again, these are just examples, but Surgical Scope Fund, which is the committee that I'm on, this basically tries to protect patients by not allowing paraprofessionals or non-physician providers to perform surgery on patients' eyes. For example, optometrists trying to perform lasers, injections, eyelid lesion surgery on patients when they have not gone to medical school or performed a residency training program. OPHPAC is another, this is our national American Academy of Ophthalmology PAC that speaks to candidates for United States Congress. And then there's also state IPACs, which are political action committees that are specific to, let's say, Florida or Texas or New York. Social media has become another avenue where we can speak to different political issues. We have a couple of closed Facebook groups. One is called Ophtho Influencers. Another one is called Yo Influencers. Some of you may be on these. We're looking at, Twitter and Instagram also, whether these are going to be, official American Academy of Ophthalmology, accounts or non-official. It is in discussion at this point, but we also have the Safe Surgery Coalition, which is a website that you all can look up. Safe Eyes America, another website. And then again, we're working together with the American Academy of Ophthalmology, OPPAC, and the Surgical Scope Fund, those two PACs that I just mentioned earlier. So just in summary, so main thing is get involved. Remember, if you're not at the table, you are on the menu. So you need to make sure that you are at the table, you're involved, you are educated, right? Education is the antidote. So if we can educate our patients, educate our legislators, so that they are informed, they have the right facts, things go much more smoothly for our patients and for our profession. We need to do this together as a team with others, whether that's with your societies, with fellow ophthalmologists, fellow physicians, and then don't forget the financial contributions. I'm not sure exactly how that works in different countries in Europe, but at least in the United States, very important that we come together and contribute so that we can speak with a unified voice, so that we have all of ophthalmology speaking, one theme, one message. So I believe that is it. And thank you very much for your attention today. That's my email. If you have any questions, please feel free to shoot me an email. And I wish you all the best. I hope everybody's staying safe. And I look forward to seeing you all next time. Thank you.
Thanks a lot, Darby, for your excellent presentation and advocacy.